He's the president of the American Medical Autism Board as well as the founder of it. He has 2 practices, one in Columbus to service our children and one in Cleveland. But he treats people from all over the world. He's been over to the Middle East to help them set up clinics because autism is exploding in the Middle East and internationally. And the report, as you just saw coming out from Korea, 1 in 38 boys.
I saw that. Oh.
Devastating. And so again, there's so much to be done. You can only do little increments. I chose a very small increment. The dietary intervention. I think dietary intervention is so interesting in the way, again, the medical community has approached it. If you were to have high blood pressure, if you had diabetes, if you had a heart condition, they would absolutely acknowledge that you needed to change your diet. However, in autism, they will not acknowledge that dietary intervention, they call it anecdotal. I have a terrific anecdote, and his name is Daniel, and it's a successful one. And there is research, unrecognized research, but there most certainly is research to indicate that removing bad things from your diet can help you. It helps all of us. We look at our children today, obesity rates are up. Every single syndrome we know related to the autisms, Tourette's, ADD, ADHD. Let's remove sugars, let's remove food dyes, let's remove trans fats and monodiglycerides and see if our children can focus a bit better. Let's see if dietary intervention can help. It's the same thing with the process of autism recovery. So many times my husband and I have been told, you can't cure autism. Why is it that we can have some cases of recovery in other disorders? Many, many women have recovered from breast cancer, and many haven't. And that seems to be an acceptable dichotomy.
But years ago, though, they said it wasn't possible, right?
Exactly.
So those same women that went to those camps, in a sense, where you pick this camp where they said it's not possible, you pick that camp and they said it was, well, those women that decided I'm not going to listen over here
are living.
They're living. So they must have done something right. And I really feel that a lot of us in this community, we're just picking this camp. And one of these days, hopefully we see autism, and I like how you said autisms because I do believe it's different things we're seeing. But I'm hoping one day we start to see, years to come, where nobody really knows how that camp started because we weren't there when the breast cancer camp started.
Exactly.
But there were women out there and there were doctors out there that said, I'm not going to listen.
We can beat this.
We can do this,
right?
We can beat this. And so there's going to be a moment. I really believe it. I really believe there's going to be a moment when that little boy or girl's, diagnosed, and they're going to say, gluten-free, casein-free. Look at the supplements. Look at the chemistry of the child. And guess what? It's not going to be non-mainstream. It's going to be mainstream.
Exactly.
And that's what we're going to need.
Back at chemotherapy was considered very, very alternative at a time.
And now what do? One of the first things they do.
Exactly. And chelation for our children, getting those toxins out, that should be mainstream. Hyperbaric oxygen chamber treatments, that should be mainstream. Dietary intervention, enzyme use, that should be mainstream. These children are recovering. My child, while still severely autistic, has recovered immeasurably and continues to recover. He's only 11. Imagine the potential. We start these children as early as possible. The signs that I saw where he was looking at lights and fans, had I known what I know now, I would have jumped right in with craniosacral therapy. In fact, I would have had a craniosacral therapist in the delivery room when he was pounding his poor little head against my pelvis saying, let me out!
I would have been putting probiotics in my child's mouth the minute he came out.
Exactly.
If I would have known. Looking at the colic of the baby, and we were listening to other doctors, and they were talking about oxidative stress, Looking at those as signs, not knowing what we knew,
Right.
I was just, rocking, giving all the gas gas drops and changing the bottles and doing everything we thought we were supposed to do. Because I was joking with somebody earlier today. I said, I read all the pregnancy books. I did all the
Did we live in the same house?
Because it feels like that, right? And
I did.
It was not on that checkoff list. I checked off everything.
I actually often joke with people and say if I ever had another baby, we only have Daniel. He's the working expense of the 6 I would have had.
That's what I always say too.
But really, if I had another baby, I would be tempted to, do everything unhealthfully. Drink, smoke, throw him on the carpet, let him eat Burger King French fries, bolster that immune system. Because we did the organic, I breastfed for 3.5 years, you name it, we did it, and still, and the vaccines crippled him. And so I think it's so important that we take a look at the whole ball of wax and recognize that these children are so medically ill, so medically ill. Anyone who tells me that autism is not medical, I provide the data that my son has had 28 surgeries in 11 years. It's an illness, it's a disorder, it's a disease, you can call it all of those. Please don't suggest that No Child Left Behind is going to provide all of the therapies and treatment that this little bunny needs.
Yeah.
Because that's just not the way it is. And we need everybody on board. We need Congress, we need insurance companies, we need pharmaceutical companies, and we need Joe on the street to say, autism is frightening. Autism is shocking. I've often also said to my husband, if Daniel had leukemia, I would be at Rainbow Baby's house sipping juice while they took care of him instead of forging myself, fighting, trying to find a treatment protocol instead of being told there's nothing you can do. There's something you can do. And don't tell mommy. Don't tell mommy. There's nothing you can do. Don't tell the most brilliant dad there's nothing you can do.
It's just when your child is sick. It's not autism and vomiting. It's not autism and rashes. It's not a coincidence that the child has constipation or that they won't eat certain things or they can't stand the collar on their shirt. They're not two different things. It's not behavioral. So it's just these things are together, and to be told that a rash on your left arm and the rash on the right arm are not connected and they're two different diseases is ridiculous in other medical settings. But when it comes to autism, that's what we're told by the mainstream. It's just not true. And there are things that are not right with our kids medically because they are abnormal biologically, and we can help work on fixing them so their autism, their Asperger's, their ADHD can get better.
Now, why do you think 1 out of 91 between the ages of 3 and 17 today, and even you talked about the other study of 1 out of 38 in other countries?
The Korean study,
So what, I was on an airplane earlier this week, and people said, oh, they're just overdiagnosing. What do you say to that?
Well, I'm going to let you finish because I know you've got a lot to say about this. Where are all the 40-year-olds in diapers that don't speak who have sensory integration problems and constipation and can't drive a car and tie their shoes and so on? We never, ever, ever saw the number of autistic persons, even Asperger's and ADHD, that we now see. And to say that things like Haldol and Risperdal and Ritalin are now being used more because we recognize that it needs to be used more. They're being prescribed more because there's more of these problems out there. A small amount of the increased numbers is probably due to more awareness and better diagnosis, but not much. There just is no way that all of these problems, and they are merging with other problems, okay? Abnormal lab tests, all the labs have made their immune function test lower. All these other things, the issues with things such as findings of rashes and all kinds of upsets and seizures and things of that nature that aren't within the autism spectrum are increased. There's a whole epidemic of things that are happening, and to ignore it and try to fight this and blame it on parents for bad parenting and so on. That's the way they started in the 1950s.
Refrigerator mother, right?
Refrigerator mother. That was their first angle. The next angle was it's genetic.
We got blamed for everything.
It's genetic, but it didn't show till your child was 3.
Yeah.
Well, I would tell you my response to this is twofold. And the first is, I'm not a scientist, but even I know that you cannot have a genetic epidemic. So I don't buy into the genetic piece of it, because if that was the case, I could simply look at my genetics and my history and it doesn't exist. I also say, go to the real experts with children. Go to the education system and interview the teachers today. Every one of those teachers will tell you they are overwhelmed with the number of children on the spectrum that are in their classrooms today. These are teachers who've been teaching for 20, 30, 40 years. They've seen it. They've seen the rise. Those are the experts you want to talk to, not the ones, the naysayers that are trying to treat autism as a hot potato and say the only reason the numbers are bigger is because they're recognizing it more. Let me assure you, your son and my son would not have been overlooked or undiagnosed 20 years ago. You can't be in the room with our children for 5 minutes and not know that there's a bit of a problem.
Yeah. When they're flapping or rocking on their toes or humming or rocking back and forth.
Or not speaking, or not toilet trained at 8 years old. How do you miss that?
Yeah, or lining up toys and everything has to be in an order. Pretty sure that's a little different.
How did the parents and the doctors miss that 30 years ago? But we don't see those.
And they like to say that also that perhaps that was classified as mental retardation. Again, these children are so bright. You can see it in everything that they do. And you ask the education system, ask the educators, ask the teachers who've been teaching for years and years and years. They've never seen anything like this.
Never.
They are the ones that will tell you, this is an explosion. This is overwhelming the school systems. This is overwhelming families. And there isn't anyone today that I don't say, oh, I have a son with autism. Oh, my neighbor. Oh, my sister. Oh, my cousin.
Yes. Everyone knows somebody.
Everyone knows somebody, and everybody knows what it is because it is recognizable. It isn't something that was a secret until we suddenly discovered how to diagnose it. It exploded, and it coincidentally has exploded with the explosion of toxins and all kinds of things in food, in the environment, in our vaccinations, and with the number of vaccinations provided. I always like to get this point in, if I may, about vaccinations, and that is, if you and I, and you're a little taller than I am, were to get food poisoning from today's lunch and we were rushed to the hospital, they would take into consideration our height or our weight before they dosed us with any medication. Absolutely do not dose vaccinations. So my tiny little baby got the same exact dose as my neighbor's son, who was 12 pounds at birth. How is that possible? How is that medically ethical that they're not dosing such powerful, powerful things they're putting into our babies? So I think it's important to recognize there's a financial interest in vaccinations and getting them out there. The reason they're dosed that way, the reason that they have the preservatives and the poisons in them that they do, is to make it cheaper to have multiple dose, not an individual pure vaccination. Not anti-vaccine per se, I'm anti-CDC scheduled vaccinations in the United States of America.
That's a great point. Absolutely. Now, I have to ask you guys, how long have you been married?
Almost 16 years.
And what is the secret? Please tell us.
A lot of times